Hi, Dr. Somareddy here, going over some different aspects of professionalism today. One of the things that's very important in our profession is to make sure that we have physical therapists and our administrative staff, physical therapy assistants, anybody involved in our profession, considering the professional aspects of our business as well as the administrative aspects of our business. So a lot of times the patient care can get lost a little bit, but essentially patient care is the most important thing. As a private practice owner, I've been in practice for a number of years. I've gotten to see a lot of different things that are both good and bad about running a business and also being part of the physical therapy industry and delivering care and service to our patients and also care and service to our staff. So what I want to do today is go over a couple things that are relating to this aspect of professionalism. It's a bit of an umbrella concept regarding the service we provide for our patients. I've listed 4 different things that would help kind of convey this message to not only the up-and-coming new physical therapy professionals, but also to the current physical therapists that are out there, and in general to the administrative folks that are out there as well. So I'm also a board of trustee to the Physical Therapy Association's Political Action Committee, and I've gotten a chance to speak to a lot of private practice physical therapists out there, and just general physical therapists alike, about different aspects of our field and how we've grown since I became a physical therapist in 2001. Along with that, I work with a consulting group, Measurable Solutions, and those guys have given me the opportunity to work with other private practitioners who are active in the field in private practice to learn a lot about different aspects of their businesses. So altogether, I've spoken to a lot of different people over the years, gained a lot of different backgrounds and information regarding different aspects of professionalism. Our profession talks a lot about it in school, and it's also giving us courses to students coming out of school in the first couple of years as young practitioners and young professionals. So I've developed a list of 4 things that we're going to go over, and the first thing that I want to go over is service and care. One of the most important aspects of our field, obviously, is caring for people and helping people out and making sure that patients are delivered to. A lot of times we find that we work with patients and we try to deliver the best care we can, and we focus on the specifics of our motion testing and our measurements and the general aspects of evidence-based medicine, and that's really important toward being objective in our clinical aspect as kind of like scientists, but also being more specific in how we practice and how we get paid and how we work toward it. And in some of the conversations I had with patients over the years, and these are many conversations, one of the things they've always commented on is how much a physical therapist cared for them, how important it was when they did care for them, and also how bad it was when they didn't care for them. Many things were mentioned, like the way the physical therapist spoke to them, how warm or cold they were, how pleasant they were, their bedside manner. And a lot of times with patients who don't feel comfortable, they oftentimes won't say anything about the physical therapist's bedside manner or how much they cared. They just won't come for physical therapy. And because we are in the service industry, a lot of times the loss of a patient that goes out of physical therapy to another practice or perhaps to another professional or perhaps doesn't even do anything about it anymore is kind of a bad thing for their health, because as we know now, we're starting to see a lot of patients that are getting sent to us from primary care physicians and even walking in the street with direct access that need to be serviced with not only a good physical therapist, but somebody who actually understands their problem and also cares about them. So caring for a patient is very important. And it's very important for them to have the right perspective too, because caring for a patient doesn't involve just you as a physical therapist, it involves the whole organization as a whole. If you are working well with the PTA, if your physical therapist is working with your PTA, and you have a good team atmosphere, the patient will feel more comfortable that the whole group cares. And if there's an administrator, like an office manager, that comes by and asks a patient how they're feeling, how they're doing, if they would like to write a testimonial about their services, or if they could get them a glass of water, or even just as simple as asking them, tell them about their insurance payments that are due or coming and how much their cost of their reimbursement is to us and how much they would owe. These simple things show that we care. I had a particular example in the clinic a number of years ago where a physical therapist was working with a patient, and he had a disagreement with something regarding an administrative aspect of his job or a clinical aspect of his job, and him and the physical therapist had a silent conversation about this. one of the patients overheard a little bit of it and they kind of didn't feel comfortable. They eventually went and reported that feeling to me actually, as the owner, about 6 or 7 months later when they decided to come back. And in their conversation they said to me that they were considering not coming back to physical therapy at our facility because they felt like the physical therapist didn't feel comfortable with the physical therapist and what they were thinking. And in reporting to the other physical therapist what that particular physical therapist felt, it didn't feel good. Now that's not an ideal thing to have happen in your clinic, but it does happen. And the impression that left on the patient was a level of uncertainty and unsureness about what the facility was about. And not only can that hurt the patient, it certainly can hurt the physical therapist and the organization as far as its stability and its future growth, and also that patient's willingness to refer their friends and family, perhaps tell physicians, and so forth. So overall, it hurts a lot of different people when things aren't done the right way. If a physical therapist had a problem with certain things, that physical therapist should address it privately with their senior, their manager, or somebody who's in a position to make a change, but certainly not in front of a physical therapist or a patient or in a patient care atmosphere, because that can certainly give the message to the patient that there's less care in the environment, or the person may care less because he doesn't agree with something about the clinical environment. That individual also happened to be somebody who had some authority in the facility, so that also created an uncertainty for the patient where they were understanding that this person had some more control over what was happening, and he was not agreeing with that control, or he was not agreeing with the fact that he had something to do that he couldn't manage or control. So it's actually an important point to consider when you're hiring somebody, as well as to make sure that everybody has an agreement on the general aspects of the clinic. But more importantly, if you don't, is to kind of get into communication with the right people, not in front of patients regarding that. And things do happen. People do disagree with things, and it's a common thing in the workplace because it happens. So that's an important aspect of service and care that I want to go over with. Number two is a concept of loyalty. A lot of times when you join on to become a therapist in a group, or you sign a contract, or you decide to take a job at a facility, it shouldn't be taken on with the viewpoint that you're going to be there for a year or 2 or 3, or just try it out, or just get there for a couple of years of experience. Those patients that come to see you are relying on you to be there, and most of them will, if you ask them, most of them, if they like you, would want you to be there forever. They want you to be there and contribute to the group and do different things to help the company, not from a growth standpoint, but just from a care standpoint. Those patients are looking forward to you being there and being helpful to them. So in a lot of situations, we see it often that a patient will come by and say, hey, you know, Mr. Smith, Mr. Smith will come by and say, hey, is that therapist John here? And they'll call in and ask to come back to therapy after a surgery or something. And yeah, John's been with us for the last 5 years, of course he's here. And the patient's really excited about that, and he's just willing to kind of, get going again. It's a question that's oftentimes asked because people get to be, obviously people get to be more comfortable with a particular therapist. So having loyalty to your organization and asking the right questions to making sure that you feel like you're taking on a good job or you're committing yourself to something falls in line with the loyalty aspect of it and the commitment aspect of it. So when you decide to do something, make sure that you live up to your word and you stick to your word, because that is really more relevant in regards to patient care, but also to the organization or the job or the employer's ability to tell their patients that this particular therapist is going to be here and help you, not only just for today, but over the course of the next possible couple of years. And that stability and that loyalty that the therapist gives says a lot to the patients. Even if the therapist is a new grad or somebody who's not been doing it for a little while or came from an environment where they're doing some more home care, the patient knows that the therapist will be there long term to help them. That's a very important aspect of patient care. The third one is honesty. So this kind of goes a little bit with loyalty, but it is a very important aspect of communication. A lot of times there are situations that come up where people are uncertain about something that's going on. They may not be happy about a particular situation, or they're totally happy about a situation and they don't communicate it. But if the question is asked to a therapist or to a patient about what's happening or how they feel or what's going on, it's very important for the person to be honest. This is kind of like a general code of conduct for people in life in general, but in the workplace it's very important that people communicate with complete honesty. This is a bit of an it's a bit of an obvious thing to have honesty as part of your mantra of treating and working in an environment, but the people that work with you, the other staff members, the patients, the people that rely on us, even the community, they rely on us to be honest and rely on us to be very open about about what we're doing and being very truthful. So that's kind of an obvious one, but again, it's a very important one to consider when you go about being in a job, taking a job, and also just in general communicating with your patients and your fellow staff members. The last one I want to go over with you is just hard work. We are in a field of caring for patients, and we are in a field where patients come in with us with different problems. Sometimes it's as simple as having a surgical procedure where their proximal or distal joint gets stiff and it's given them a problem, or they're not comfortable, or they're afraid of moving it too much, or a geriatric patient who may be a little more concerned about falling and nervous about doing some particular activity. That extra work that you do to motivate a person, or that extra work that you do to stay longer to do the paperwork, it really does convey in hard work. There's nothing wrong with working hard. We do have a very interesting industry with our insurance industry where we don't generally get paid more money from the insurance company for more work that we do. Usually it's kind of the other way around, where we get paid a rate that doesn't change over the course of years. So the hard work that we provide ultimately will lead us to become more efficient in the way we do work, because the harder that you try to do something, the more you should get better at doing it. And ultimately that hard work pays off in patients coming in for referrals from the physicians, from the patients, but also it shows in each other. You know, if you're working hard and somebody next to you is uncertain about something, or somebody else is kind of dogging it a little bit, your hard work is setting an example for them so they can work a little harder, because like a team, they always want to keep, they always want to keep the momentum going, and they also want to be part of the team. And this hard work, this additional work is very important. So generally people who work hard are not people that are going to complain about things, and they're just going to get the job done. And there's nothing wrong with having a complaint or not being happy about a particular thing, but if you work hard at something, you could always figure it out and solve it. And even as a new grad, you tend to come out of school and you have a lot of good things going for yourself as far as motivation and desire to learn and all. But no matter how you slice it, it's very important to work hard, because that working hard not only contributes to the organization you're in, but also contributes to your skills and your development and your habits. Hardworking people tend to work hard throughout the whole course of their lives, I've seen, in talking to different patients and talking to a lot of friends and family, and just overall having an experience of living, is that as you develop a habit of doing the right thing and working hard, you tend to create that effect in other people, and it continues to go through in everything you do. We see it also in the clinic where a hard-working therapist is willing to do extra for his patients, and those patients appreciate it. They really feel like that therapist has given them something that's a caring thing for them. It's that little extra time that might be spent with them, or listening to them a little bit longer, or certainly just taking a schedule that you might have and working it out for a patient who has a tough situation getting here or traveling. These are little things that can be shown as hard work that may not come out as just putting your nose to the grindstone and kind of working long hours, but there's a little bit of these things that you can do to show that you're working effectively and also working hard to get a simple thing done or a complex thing done. So that's all the list I have for today. I hope you guys enjoyed that first segment of professional development, and I hope that you could utilize some of these simple tools in your day-to-day operations.